Good morning, everyone. Thank you for joining us in Rare Strides. I'm Trina Myers, and I'm the host today for today's Rare Strides. And we have a very special guest with us. We have today Beth Nguyen, who is the founder of Rare Strides. Thank you so much for taking some time with us today, Beth, to tell us a little bit more about Rare Strides and why you got it started. So, how about we start out with that? Can you tell us a little bit more about your who, when, where, and why?
Sure, Trina. Thank you so much for having me today. It's an honor to be here. And basically, Rare Strides was established out of a passion for the rare community. It's also in my own journey from what I used to do and still do in many respects, working as a nurse in many areas of healthcare, and then having my own rare journey really opened my eyes to a lot of disparities that patients face as well as their families when they go to get care for their rare disease. It's really difficult in today's healthcare setting. And unfortunately, when we go to get care from really any clinician, there is a pause when it comes to connecting us to resources and next steps for our disease. And in that, that's where we lose hope as patients and families. We feel despair and like, does anybody care? Is anybody working on how to help me in my rare journey? And that's how Rare Strides was born, because Rare Strides is all about connecting care to children and adults with rare diseases. And the way we do that is through connecting them with next steps in their care journey through our multidisciplinary rare model of care, and also with interactive diagnostic tools. And Rare Strides is different in that we provide those resources for free to patients and families. And also, we invite the involvement of 501c3 nonprofits, and that is for free as well, because we know that they have fantastic and amazing resources that they can share, that they've worked really hard on for many, many years. And it's a shame that a lot of medical professionals don't know how to find their resources. So we want to basically bridge that gap and let medical teams know how to find those resources so that there can be better care for our community as a whole. So in that, even plugging in my own rare journey, if in my first clinical visit, my doctor had ordered the correct test, for example, or provided me with better management for the common complications that went with my rare disease that they treat every single day, it could have prevented further complications, saved me a lot of time and heartache. And, that's what I do every single day. I go to bed and I wake up thinking, how can I serve my rare community? And that really is the foundation that Rare Strides was built upon. Rare Strides is here to really provide powerful, customized tools in healthcare for our rare community. And we're proud to do that. So I hope that explains a little bit.
Yes, it does. And, I was so excited to learn about Rare Strides being in the metro Atlanta area. And when Beth, you had reached out to me, you were not aware that I even have a rare. So, it's very unfortunate. You look at you and you look at me. I don't have the typical look of a rare disease. And so I think it's important to make rare visible. And that's kind of the tagline for Rare Strides, which is a really great mantra to help people understand all the different rare diseases there are in the world and help people connect, as you mentioned, to those tools.
Yeah.
You have the Rare Strides has got a campaign that just launched August 1st, and that's Code Rare.
Right.
So, can you tell us a little bit about that?
So, Rare Strides Code Rare is a nationwide call to action to really make rare visible to medical teams and to start that initiative of getting that education into healthcare settings. As many know, we are in development for a mobile app that communicates with a clinical portal. And we started thinking, how can we get engaged now? What can we do now that's going to make an impact even while we are finishing development? Because we're going to be in development for a very long time. And we started thinking there is something we can do. So, really, Code Rare is all about making rare visible. And the way we do that is through interactive tools that are created in collaboration with our 501c3 nonprofit medical boards. And even in applying one sample scenario, if I, with syringomyelia, call 911, for example, then will first responders and my medical team in the ER, for example, know what my disease is, maybe what the ICD code is, what some of the common complications could be. And the answer to that is we have tools that we can create that they can easily access to give them information about not only my rare disease, but all the other 7,000 rare diseases. This information will also be linked to CME so that medical teams, nurses, doctors, they can also get CEUs, for example, while they're learning about rare diseases. We also have the ability for a parent of a child or even for myself. There are certain tests that are often overlooked for my rare disease, and we have the ability to really get the involvement of the parents and the individuals with rare diseases, because we want to say, hey, if there's something that you want them to know, if you were in an emergency, we now have a way for you to create that, to share with them, so that even if you can't talk, they will have access to that. We're not trying to reinvent the wheel in any way, shape, or form. We're simply trying to connect the dots. We're trying to bridge together the resources with the providers and the nurses that are taking care of the patients. I can tell you that many times, even in my own case, when I go to the ER and I talk to them about how it is that my heart can race, or I'll only sweat in certain areas, or some of the symptoms I experience. When I talk about how syringomyelia can damage the spinal nerves, for example, then they understand. They're like, oh, that's what it does, right? I may not know how to spell your disease or pronounce it for that matter, but now I have a link or information to, or access to vetted information about your rare disease. And not only that, but I also have information about the specialist and the other individuals who maybe have created videos or published amazing articles that really will support my journey and help my medical team understand what it is they can do to support my care. And perhaps even identify or rule out other conditions that I might be at risk for. And in my own case, it's really important when I go in for tests and other treatments that my doctors understand how to take care of me. Even when I have a common complication like central sleep apnea, it's not only important for them to understand that I need my CPAP and why, but it's also important that they understand why I have central sleep apnea. because there's 1,000 ways that someone can develop it. But if they also understand how that happened to me, then I feel like they'll be more engaged and more willing to learn. So
Absolutely.
yeah, it's about bridging those gaps.
It's a win-win for everybody.
Yeah.
I know there's been many times that I've gone into a new physician's office or for treatment, and they're like, "What? What is it?" One of my rares, because I know most of us have more than one, but one of mine is hypogammaglobulinemia, which is an immune deficiency. And a lot of times I just get a glazed look over their face, and they're like, "What?"
Yeah.
So having these tools is great for us as an individual who has the rare because it helps us learn more, but it also is great for those that are taking care of us that may have never been exposed to the rare world.
Right. And it's really close to my heart in that even when I worked as a nurse, it wasn't, and I still do that, but I can't do bedside anymore because of my some of my complications, and I do miss all my colleagues. It isn't that they don't care about rare diseases. I don't want anybody to ever think that. And it isn't that, they don't want to learn. I know for myself, I simply was not aware that there were 7,000 rare diseases that I needed to learn about. I didn't know.
Right.
If I had an initiative or some kind of, something in front of me to say that, yes, there's 7,000 rare diseases and this is not so rare, meaning that you may treat 1 out of every 10 patients that you see will have a rare disease. If I knew that and I had resources to give them, then I would want to participate because I want to provide safe patient care and give them excellent resources. In my own case, it took me probably 2 years or more of Googling and internet searches before I found credible organizations so I could dispel myths. I can't tell you how many visits I had that said, "You're the only one in Georgia with this disease. You're going to die when you're 42. I'm 43 now. I'm still thriving." There were so many misconceptions about my disease. And through searching for credible organizations like the National Institute of Health, reading articles on PubMed, some of the awesome 501c3 nonprofits, then I was able to find information and know that, no, that's not true. These are some of the complications, but I can have a full life if I have excellent management of these conditions.
Right.
And something else I want to say is that, many times we go to the doctor and primary care or whoever we might visit with say, "Well, you need to go to the specialist because I don't feel comfortable. I don't know how to treat this illness." This is really one of my passions with Rare Strides, is that every doctor in every state and every specialty can have access to the same information so that they can feel comfortable knowing about that rare disease. Part of the unwillingness I feel to even treat a disease sometimes is based on inexperience, not knowing what might happen next. But it's the doctors we see most often and the nurses and respiratory therapists, child life specialists, for example, all members of the medical team, if they're engaged and they have access to credible information on rare diseases, they'll feel more comfortable in taking care of someone with that disease. And that's what I hope we get to through this nationwide initiative.
Absolutely. Al, I wanted to also touch in on, because you've mentioned the education part of it. I've worked for medical school, and I know that they're taught to not listen to, they're taught to not listen for the zebra hooves, if you will. And so you see a lot of zebra associated with rare diseases, and you have a beautiful zebra behind you. So is there anything else besides not listening to the zebra hooves that you think it's important for people to recognize the zebra for?
I think that it's important, and I understand the perspective of we need to rule out all the common things first because that's what they're most familiar with. And they already have tests and procedures and labs to look for common conditions. So it's easy to rule out, right?
Right.
It's kind of the old mantra of saying, but my doctor thinks I'm crazy. They're sending me to a psych assessment. Should I do it? It's like,
Right.
absolutely, because we want them to say you're okay and that it is
Right.
a medical problem, right? So go
Right.
ahead. But I think in that, once you've ruled out the common complications, it's important to consider the possibility that it might be a rare disease. We still have some time to go before we can rapidly identify a rare disease. And we don't ever want a doctor to say, oh, I'm just looking for that alone, because it might come with a whole host of other complications you can treat. One prime example of that is heart failure, right? In my own case, and this may sound repetitive because I've said it many times, but I have syringomyelia, I have syrinxes in my cervical, thoracic, and it really wreaked havoc with my vagus nerve and caused dysautonomia, which in turn caused a domino effect. So I have a lot of trouble controlling my heart rate. And over a long period of time, if your heart races and it's not controlled, then you will develop injury to your heart muscle.
Right.
And that's what happened to me. And with a simple intervention with something like metoprolol in my case, that's what worked to slow my heart rate down. It was easy to address. But yet, because there was so much fear around the term syringomyelia, I felt that there was a hesitancy to even address the complication. So what we're hoping to teach is that, hey, we just want you to consider that this might be a rare disease, so that once you've said, oh, we can't figure it out, let's try this one more avenue, right? We want to provide hope, and we want to remember and honor those who are fighting so hard every day to live and fight these battles with rare disease. That's why we're here doing this, is to be another voice or beacon of hope for children and adults with rare diseases in healthcare, so that they say, wow, here's a healthcare company that has nurses and doctors that are advocating for us in healthcare. And now, through this Code Rare initiative, when I go to the medical office and I see that my doctor has a certificate saying, yes, I'm participating in Code Rare, it's like, thank goodness. They may not know what my rare disease is, but now they're telling me they care and they're going to learn about
Right.
rare diseases. And that means so much to our community who's felt invisible for so long.
Absolutely.
It really
So
means
if somebody was wanting to get involved with Rare Strides, whether they're a physician, a nurse, or an individual who has a rare disease, how would they go about contacting Rare Strides?
So they can contact us, of course, through social media, but we have Code Rare at rarestrides.com. We also have a Code Rare page on our website, www.rarestrides.com, where we get their message. And they could specify whether they're a patient seeking resources or a nonprofit, or if they're a provider. And right now we are recruiting nurses for this fantastic effort. We want nurses from all walks of life to help us in getting these educational tools built. We're looking for 501c3 nonprofit leaders and their medical boards to get involved and to build a tool for their rare disease, or multiple tools if they want to. We are looking for patients and their families to get involved, maybe to even, build an emergency flyer. We have these amazing tags where they can be scanned by a medical professional and they can see the education instantly. We also have these awesome Make Rare Visible stickers that glow in the dark.
Oh, how fun.
Yes. We have podcast opportunities because we want people to talk about the disparities so that we understand how to better address them. if you're participating in Code Rare, we want to hear the success, right?
Absolutely.
We want to know, how has this helped you? Maybe just with this one individual, right, that got repeated infections and complications because isolation was never implemented, and then we test piloted Code Rare with one individual in one state, and all of a sudden they're 911 all the way through the hospital. There were no readmissions, no infections, because isolation was implemented immediately. That's
great.
what we want to know.
Yes,
absolutely. How has this helped you? So if you want to participate, the short answer is rarestrides.com is free. As a community, if we want change in healthcare, we have to be that change. And we're asking you, come on, let's do this, because we can save lives and we have a responsibility to do that.
Yes, let's make Rare visible. Absolutely. One more last question is, what do you see coming up in the near future? Anything new that you haven't spoken about yet?
So coming up in the future, what we like to do rolling out is we want to recognize medical teams that go above and beyond for individuals with rare diseases. We have what we're going to roll out is a Strides for Hope award, so that we can honor those medical teams that are really making a difference for our rare community. And at the same time, we have another initiative that we're going to build up called Rare Wish, that's going to give back to individuals that have been suffering with rare diseases as an award, a way to say, we see you and we care. We care about your journey and we want to help.
Wow, that's so amazing and so touching. Thank you so much for all that you do for those of us, including yourself, to help make Rare visible. We couldn't have done it without you. You're the one who started this, who had the vision, and is making it happen.
It's an honor to serve my rare community. And if it can help people, help change a life, then hey, that's the biggest reward.
Absolutely. So, it's all worth it.
Yeah.
Well, is there any last thing you'd like to share with our Rare Strides community?
I just want to say, don't give up. Keep fighting, because we are successfully building up momentum to really make positive changes in healthcare, so that your rare disease is visible, so you can receive the care that you deserve, and so that we can make a better future for children and adults with rare diseases. So keep fighting, and we're here to fight right with you.
Absolutely. So we hope to see you again. We will have another Rare Strides show in a couple of weeks, and I hope you'll join us then. Until then, have a wonderful weekend, and we will see you soon.